Welcome back. You're watching The Agenda. Now, the future remains bleak for a lot of NGOs that rely on donor funds from the US, such as PEPFAR and USAID. Now, organizations like Section 27 are faced with the task of finding ways to curb the effects of the suspension of the aid from the US. Now, did they find any solace in the State of the Nation address, we ask. Now, Khanyisa Mapipa is the head of health rights at program at the Section 27, joins us now for more. Thank you so much for your time on the program. So let's first of all just get your reaction to the State of the Nation address on the health front. And let's just hear from you, because we heard so much on the health front from the president that this year they will proceed with the preparatory work for the establishment of the NHI, as well as other health matters.
Good morning, and thank you for having us. Our reaction to the State of the Nation address is pretty much that we are quite disappointed that we didn't hear more about the plans that the government has in terms of filling the gap that has now been created by the withdrawal and pause of PEPFAR and USAID and other US funding. We heard quite a bit about the preparations for NHI, which is all well and good. We had hoped to hear a little bit more about the government's plan on private health and what the government plans to do to regulate private health now that medical aids will no longer be dissolved. However, what was more pressing was this issue of HIV funding in the country being pulled by the US. We know that South Africa receives quite a significant amount in terms of US assistance. Just in 2023, the number was $278 million, which translates to billions of dollars in South African rand. And of that, $178 million was allocated towards PEPFAR, which is the US's assistance of our HIV response in the country. That amount assists about 1.4 million South Africans in their response funding, and that is the number of people who are solely reliant on PEPFAR for their ARVs and other HIV treatment. And so to have that money withdrawn from the system is going to be quite a knock. And we know that quite a lot of patients and quite a lot of health staff who are now without their jobs are eagerly waiting and actually anxious to hear what is going to happen, what is going to be the next step. And we had nothing to that effect from the president in the State of the Nation address.
And Ms. Mapipa, the conversations are always about how we will be addressing all these gaps. And we've heard even throughout the State of the Nation address, I mean, the president said that the NHI will reduce inequalities in healthcare by ensuring everyone gets fair treatment. It's easier said than done, if you may say. But does this also not give you a sense that, I mean, government is, serious about getting its house in order?
Not at all. The NHI has been something that has been in the making for over a decade in this country, and yet to this day we have yet to see any active implementation of such a program. We've yet to see this equality in terms of public health service recipients or public health users compared to private health users. The government obviously sees that there is an inequity in terms of the treatments that people in the private health sector receive versus that the people in the public health care sector receive, and has done absolutely nothing to address it. Over the years, we have had inquiries like the health market inquiry that the Competition Commission poured millions into, and yet and made proper recommendations, expert-backed recommendations on how to fix our health system, both in the private sector and in the public sector, and none of that has been implemented. And now we see little by little that parts of the act are being, set aside or are not going to be implemented in the way that we thought they are, and yet none of it is being replaced by proper plans on how we're going to achieve this health equality that we desperately need in this country.
And quite a sad state of affairs is what we're seeing with the withdrawal of funding, because I get a sense that it's the people that are on the ground that are going to be hardest hit.
Yes, exactly. I mean, currently there are about 15,000 healthcare workers who were paid directly through the USAID funding that we were receiving as a country, who are now sitting at home without a job. They don't know what's going to happen to them at the end of the month, at the end of 3 months with the pause. And now we've heard recently, this weekend, in fact, that that pause is actually going to be permanent, as the US has decided to withdraw its funding or its assistance to South Africa. So we know that, that money isn't coming anymore. But I think what is most alarming is the fact that this is not something that is a surprise. It doesn't come as a surprise to us. This was something that was that Donald Trump campaigned on in the US to say that he would be withdrawing US funding or US assistance worldwide or globally. So we knew that this was coming. We knew that this money was in jeopardy, and yet nothing was done to prepare the millions of people who depend on it and the thousands of healthcare workers. The other day, the Department of Health stated or released in a presentation that they would need about 4.6 billion to plug the hole of healthcare workers who are now unemployed, of patients who now require ARVs from the state, and then also a further 2 billion to be able to run these programs, to run the mobile clinics, to run the clinics that have been solely paid for by this US assistance in rural areas and the like. And now this money, they have to find a place where this money is going to come from. And we're hoping that the budget is going to give us a little bit of a better clarity in terms of how this is all going to work and what the response is going to be.
And just before I let you go, I know at this particular point, I'm also looking at some of the ripple effects of all of this. I mean, at this point in time when we have the boots on the ground that will be affected, the boots on the ground that are the immediate point of contact for all of these communities that rely on some of the health care there. I mean, this will also mean that dispatching of medication as well will also be severely affected, which would also mean we have now sick communities. Let's just hear from you, your greatest plea right now to all those that might be watching from Section 27. What would you say on this part?
I would say, firstly, that the impact on community mobilization or community-based monitoring for programs like Rechidze and the Treatment Action Campaign are now under threat. We know that a lot of those programs were receiving funding from PEPFAR and are now without that funding, given what the decision has been. And so it really will depend on communities to now step up for themselves, to be able to make sure that they don't default on their treatment, that they pressure the government to make sure that there is a plan. Otherwise, as a country, we are really going to regress to a point where before we even had an HIV response, when we think back to the early 2000s and how devastating the HIV epidemic was in South Africa, that's potentially where we're going to end up if we as individuals don't stand up and pressure the government to make sure that they plug this gap, and also make sure that we as individuals encourage our community members to not default on their treatment, to make sure that their facilities are equipped and their facilities are stocked with the right medication to prevent HIV transmission and also to treat HIV.
And I know that as Section 27, you also made means to reach out to the health minister. How far are we on that? Is there any progress to perhaps sit down and iron out some issues?
We have yet to receive a response to that letter. We had asked in that letter, as part of our demands, that the health minister establish a task team in order to respond or to think through the response for this withdrawal of funding. What we had asked is that civil society be involved in that task team as a mechanism through which communities and the people of this country are able to speak to the government and express their dire needs when it comes to this issue.
Right. Khanyisa Mapipa is Head of Health Rights at Program at Section 27. Thanks very much indeed for your time on the agenda.